It's 9 a.m. and you're watching Fox 31's Good Day Colorado with Shaw Turner, Ken Clark, and meteorologist Krista Legger.
Well, when you think of liposuction, you probably think of an invasive surgery that takes weeks of recovery time. Well, just ahead, we'll show you advances in liposuction. And get this, it's a kinder, gentler process that surgeons can do while you're awake. Can you imagine? And, you know, we're not going to show you any really, really gross pictures. Don't worry about that. We've edited this down so you can just get the point without getting the point.
That's pretty hard to watch, though.
Well, we've edited it down so everyone can watch.
All right.
9:19 now, coming up on Good Day Colorado. Amazing new technology that's making liposuction more gentle, kind of a kinder, gentler lipo, you might want to call it. And Denver surgeons are leading the way on this new procedure. We'll get a look at VASER right after the break. Stay with us. Well, it's about time for it. Well, traditional liposuction can be painful, cause severe bruising, and have you down for weeks recovering, but there's a relatively new process called VASER, where the patient can actually be standing and awake, if you can believe that. Now, it's been featured on several news programs, and a doctor right here in Denver, Dr. Millard, is one of the leading surgeons practicing VASER. We're going to tell you more about it now, but, you know, we did edit this down, so if you're sensitive, you know, it's going to be okay. The shots won't get too bad. So let's take a look at how this works, okay?
Practically performing this procedure with the patient awake. So this is an awake lipo procedure. We can use fast-acting drugs to make the patient comfortable and numb. Yet the patient can speak to us and be awake. This patient will be able to move herself over to the table with very little help. This is the ultrasound. Emits ultrasonic energy as opposed to tip on the side in a way that it's been tuned to only melt the fat, to leave all the nerves and blood vessels and other tissue between the skin and muscle intact. So the tip of the probe is actually doing the work for me, so I don't have to rip everything. So resistance is okay, and in fact our end point is when the resistance is gone. And essentially this.
Wow, now that's how that works. Welcome, Dr. John Millard and Dr. Robert Broadway, plastic surgeons. This is amazing, this new procedure. And Dr. Millard, I'll ask you first, why is it that you're able to stay awake during something like this?
Well, we have current types of anesthesia that allow us to have the patient wide awake. One of those would be an epidural, similar to what you see with pregnancy. The other would be we use a fluid that has lidocaine in it, which is a numbing solution, similar to what you would use at the dentist. But we use the same type of solution in a much bigger way where we're going to do the lipo.
Now, Dr. Broadway, who's a good candidate for this, and why do we want to get liposuction? Does it really smooth you out as well as people say it does?
There are a number of different candidates for the procedure. Traditionally, we've thought that it would be overweight patients, but today we're seeing, especially in the high-def patients, that we're seeing candidates that are of normal weight but really can't in the gym get that nice athletic look, and so those are the candidates today that we're doing this new procedure called high definition liposuction.
Okay. Now, I know there have been doctors who have said this will never be the magic pill where, I'm 20 pounds overweight and I just want to have that flat stomach, so I'll just go get myself some liposuction. It's not for that purpose, is it?
No, actually, VASER Hi Def should be considered an adjunct to somebody's physical fitness regimen.
Okay.
Those troubled areas, love handles.
That just won't go away.
That just won't go away,
right. Well, there are certainly risks that come with this, though, like with any surgery. What are those risks?
Those risks, like any other surgery, you have to approach this as a surgical procedure. It has inherent risks and benefits, which are pretty minimal. The patients, though, that come to us end up having their goals outweigh these risks in most cases.
Okay, Dr. Broadway, who tends to do better with this? People of a certain age, men, women?
I think the biggest thing is that patient healthy? Can they undergo a surgical procedure and come out on the other side healthy again? We operate on both men and women. I have younger patients, early to mid-teens. I've also operated with high-def patients in their 60s.
Okay, you brought some amazing before and after pictures that we definitely want to get a shot of while we're talking. So if you could show those to us right now, that would be fantastic. A lot of people say that there's a certain part of your body, too, that responds better to lipo. Is it the thighs, stomach?
You know what? With VASER Hi Def, we can do any part of the body, the arms, the breast, the abdomen, the legs, the waistline.
Well, you have a set right here. Now, this is before and after.
Right.
And, you know, these pictures are phenomenal. I'm going to guess that as we zoom into these, that her stomach was done, or her hips, waist?
Waist, flanks, abdomen.
Okay, which is this before on the side?
I hope so, yes.
Well, okay, to me, this looks like she really didn't need to have anything done. My goodness. But you can tell she's definitely flatter and more slender through the waist and through the stomach there, and you can see her abs.
Correct.
Does this go along with, now, the abs surgery? I know a couple of people who had the abs done. Now, is that something that is the new rave, or what?
Absolutely. This is, I think, the newest and latest and greatest in liposuction. VASER Hi Def allows patients that normally would not have been traditional candidates for liposuction, namely the thinner patients, once they go to the gym, to achieve their goals. And there's a lot of patients out there that are not heavy who would benefit from VASER Hi Def. Okay,
and so the gentleman here we're showing, what did he have his abs done?
He had his abs done and he had his flanks done.
Yeah, and you can tell. Yeah.
Yes.
Gosh, that is amazing work. Well, is there ever a situation where insurance would pay for something like this?
Typically not, no.
Okay. All right. Well, thank you very much for updating us on this.
Thank you.
VASER Lipo. Who would have thought staying awake during lipo surgery? Dr. Broadway and Dr. Millard, thank you so much for coming by this morning on Good Day Colorado. And if you want to know more about this VASER process, just log on to our website, myfoxcolorado.com. Look for the As Seen On tab under Good Day to learn more about VASER.